Bangladesh Malinore. Consequences of free market healthcare. Before I show you the following clip from a recent special episode of Panorama going undercover in a Bristol care home for the mentally handicapped, I need to make a few disclaimers before I establish the point of this video. Disclaimer number 1. This clip contains violence towards the mentally handicapped and actions which some viewers may find disturbing. Viewer discretion is advised. All clips in question will be at the end of this video. Point number 2. The following video is not intended to suggest in any way, shape or form that the public or the private sector is directly responsible for the horrific acts that will be shown. This is indeed an isolated incident which is done by horrible people acting at their own accord. Not every care home in the private or public sector are like this, and many within the same company may provide very excellent care for their patients. Now that we have that out of the way, let's go to the main point of the video. Free market libertarians advocate the complete and total removal of all regulations, as well as completely privatising healthcare. They suggest that the spirit of free competition will prevent events like the following from happening because it will be bad for business. The competitor who provides a better quality of service will win out on them. However, there is a huge flaw in this reasoning, as the clip will show. This is a case where the regulators have failed to spot an act of abuse towards the patients in the care home. Regulations that are designed to inspect and evaluate the quality of care given to ensure that the patients are being treated properly. For the longest time, this home acted under the radar of regulations, with staff repeatedly lying towards the family members to give the impression that their service is considerably better than it actually is. It was not until an ex-staff member acting as a whistleblower prompting the BBC to do an undercover investigation which filmed these horrid acts in question. Without the enforcement of regulations, these staff members continue to physically and mentally torture their patients who are not capable of raising the alarm themselves and barely had any understanding as to what was going on. On top of this, when there is no public option funded by taxes, the consumer who has put these patients into such care homes would be limited by their income and location. If they could not afford to move these patients to another location within a reasonable distance, then this would trap these patients within the abusive care home. And without any regulations enforcing guidelines to set a standard of how these patients should be treated, who is to say that there will not be more care homes like this? So on the larger point of regulations then, what is the difference between having unenforced regulations on the one side and no regulations at all? How is removing regulations and not making sure that these people are being treated properly better than ensuring that the regulators who are doing their job properly? Making consequences for this kind of behaviour will not always prevent them from doing these horrible acts, but it will allow for these people to be stopped dead in their tracks once caught doing these horrible acts of violence to these patients. I suspect that I will get the response from libertarians throwing in a red herring by suggesting that taxation is theft, or worse, extortion and even slavery, as some have claimed. These are generally people who are well off and can already afford a good standard of healthcare within the private companies, rather than those at the bottom relying on taxation to get the care they need, or those with a pre-existing condition. However, I must ask you, which is more immoral? Forcing a person to have a small percentage, let's say about 5%, removed from their income to provide free to the point of use access for everyone, thus eliminating any need for medical bills beyond the price-capped medication, or forcing the poorest amongst us to pay a large amount of out-of-pocket for services that have no guarantee whatsoever that they will treat the customer honestly and fairly. You may answer only half the question by suggesting that independent charity to help fund those at the lowest end. But this relies too heavily on the generosity of those with money to give anything at all, providing enough resources to say that it's guaranteed that to provide enough resources for those who are unemployed, below a certain income level and can't afford insurance, or have a pre-existing condition of which there is a large list of which they won't cover. This is a position of faith to say that this guarantees that charities will give a consistent amount of money that people are able to pay to help these people. And it still doesn't eliminate the risk of many different ways that people can be dishonest. I also suspect that the entire clip of the documentary that I will link to in the bar down below will be dismissed as anecdotal evidence against the private healthcare industry. However, these people, from my personal experience, have a huge double standard, alongside missing the point entirely. Any evidence of situations where private companies exploit people unchecked is dismissed, yet they will jump on any failure of socialised systems or regulatory failure as evidence to suggest that the entire system should be completely scrapped. Am I the only one who sees a huge flaw in this line of reasoning? And even the whistleblower that is featured in this documentary do expose expose individual care homes. What is to stop the care home simply moving on, rebranding itself, setting up shop somewhere else, and continue to abuse these patients on a regular basis? Once again, I must reiterate that the simple existence of the private sector for healthcare is wrong to begin with. This is, or rather, is not wrong to begin with. There is more than likely quite a few care homes that do an absolutely excellent job at caring for their patients. However, it must be said and pointed out whether you go for a more privatised system or a more socialised system. Getting rid of regulations and consequences will only give more room for those that do abuse their patients to grow and flourish rather than being nipped in the bud early. Al-Dial Shalah
looks after people with learning disabilities and autism. They're extremely vulnerable. Most have a low mental age. Some are suicidal and need constant monitoring. This is how some of them are being treated. By secretly filming inside the unit, the BBC found staff out of control.
You know that I don't let you get away with it.
And patients suffering. Until last summer, this 18-year-old lived with her parents in Wiltshire. And what kind of person is she?
Very lovable. Very lovable.
After a sudden change in her behaviour, she was forcibly taken into care and ended up here in Winterbourne View. Her parents had no idea any of this was going on.
She's trusted these people in there and what they do to her. Uncle, Mum. I never thought she was treated like that. Not in a million years.
And Simone isn't the only one being abused here. Our secret filming reveals staff bullying other patients for their own amusement. Clinical psychologist Andrew McDonnell viewed the footage.
Where's the therapy in any of this?
Ah!
Say it then. I would argue this is torture.
It could have been stopped earlier. Last year, a former member of staff went to the regulator, the Care Quality Commission, to report what was going on. He contacted them 3 times, but they didn't tackle the abuse.
This is the worst kind of institutional care. It's the kind of thing that was prevalent at the end of the 60s and that led Britain to gradually close the large long-stay institutions.
What should happen? to this hospital, do you think?
It should be closed down.
13 members of staff have now been suspended and patients moved to safety. The police have launched an investigation. Castlebeck, the company that runs Winterbourne View, has issued an unreserved apology. It's also set up independent reviews of its 56 homes and hospitals and is examining all patient records for any concerns. Paul Kenyon, BBC News.